discussing blood donation. Now, when you're taking the exam, the phlebotomy exam, know that blood donation falls under the topic of special collections or special handling collections. There are 3 different types of blood donations that you need to know. Please save this video, go back to it, listen to it a couple times, but just make it make sense to you. Here we go. So the first one is blood donation. With regular whole blood donation, that's your plasma, red blood cells, white blood cells, platelets, just whole blood. When you go to donate blood, they take at least 500 milliliters, which is equivalent to 1 pint. Before that they could go through the process, there's a series of questions that you have to pass. And one of them are when they check your hemoglobin, it has to be at a certain level, and they also check your hematocrit. Your weight needs to be at a certain pounds, and it's so much to it than just giving regular blood donation. Yes, you get to save 3 lives, and you get to donate every 56 days. But like I said, there's a lot of things that come into play whenever you're donating whole blood. First of all, you're getting stuck with a 16 to 18 gauge needle, right? So that's a big one. So if you're scared of needles, this may not be the thing that you want to do. But things that you need to know for the exam. You have at least 5 to 6 liters of blood. That is the average human, okay? 5 to 6 liters of blood. They can take out 500 mLs, which is equivalent to 1 pint. You will be using the pink top. The pink top is the one that checks for your blood type. So that tube is sent to the blood bank. The second type of donation or phlebotomy is called therapeutic phlebotomy. That is for blood disorders like polycythemia or hemochromatosis. Polycythemia is the overabundance, so excessive making of the red blood cells. Your body is producing way too much red blood cells and it needs to be removed. And hemochromatosis is hereditary, and it's about iron. Your iron is really, really high. So the doctor will give you an order to have that removed. What I want you to remember about therapeutic phlebotomy, you cannot donate this blood, and it is required by a doctor. You need a doctor's order to perform this type of phlebotomy. And the last one is autologous donation. That is whenever you give your own blood for a surgical procedure, where I'm going to have surgery and I don't want anybody else's blood. God forbid something would happen to me. I can use my own blood. So these are the 3 main types of blood donations that they will talk to you about, or you may see questions on that. They may ask you or try to trick you and say, which type of donation requires a doctor's order? That would be a therapeutic. Which type of donation can you provide your own blood in case of an emergency through a surgical procedure? That's autologous. Okay, so keep this, save it, do what you need to do, make it make sense. And if you have any questions, go ahead and send me a message and I will be gladly to explain it some more.